Good afternoon, everyone. Gareth Presch, founder of the World Health Innovation Summit, and I am absolutely delighted to welcome you to our discussion this afternoon. It's a webinar. We're focusing on health and education, and my guest is a pure pioneer, Kenisha Arora, an SDG 4 high-level steering group committee member for UNESCO. The length and breadth of the activities that Kenisha is involved in are just staggering. And I'm just going to hand the floor over to Kenisha now just to do a short introduction. We're going to get into the questions. If anyone has a questions, please do type them in the comments, and we'll put them to Kenisha. But I'm very much looking forward to the next 35 minutes and having a discussion with Kenisha about SDG 4, quality education, and also SDG 3, good health and well-being. Kenisha, delighted to welcome you to our discussion this afternoon. I think you're in Canada at the moment, but the floor is yours.
Thank you so much, Gareth. It's a pleasure to join you, and it's so inspiring to see the work that you and other leaders are doing in SDG 3. I am a currently medical science student at Western University in Canada, so I'm quite passionate about health and well-being and exploring the intersection of education with medical education specifically. And this year was actually the Transforming Education Summit that was convened by the UN Secretary General, Antonio Guterres, and it was focused around getting all the stakeholders, leaders, and young people in the same room to call for investment in quality education. As you know, we are nowhere close to meeting the goals that we had set for 2030, especially for SDG 4, and which is why the summit was convened to bring us all together and innovate a way forward and a new social contract. So this social contract was created by UNESCO around understanding what is the future of education. What does it look like? Who are the learners? Who are the educators? And in what form does learning happen? Is it happening in institutions? Is it happening outside institutions? Is it happening in our own houses? What does education truly look like? And so for young people like me, we're really passionate about understanding how can we have quality education accessible for everyone. And this is especially important when we start to talk about accessible healthcare and how can education play a role in increasing the accessibility of healthcare specifically in regions and rural regions where healthcare is not so readily accessible. And so the work that we're doing right now is figuring out, what are the 5 key pillars for transforming education? And what does the word transforming mean? What does it mean to not only change the direction of education, but transform it at large? So it's quite the big task that we've undertaken. And I'm actually going to be in Paris next week with the other high-level steering committee members to explore how can we properly govern global education and meet the benchmark indicators that we've decided. So I'm incredibly excited for our conversation today.
Fantastic. Just can you tell people a little bit more about your background in terms of how have you got to this stage in your career? I think people will be very interested to understand your journey because most people don't get that opportunity to share the journey that you've had. What's brought you to this stage, and what was the shall we say the point where you said, well, actually, I realized I have to make a contribution in order to further SDG 4 and make that transition.
Yeah, thank you for asking. Honestly, I didn't even start by thinking, how do I influence SDG 4? It was my best friend in high school who had dropped out because of the inaccessibility of menstrual hygiene products. And at the time, I was learning from her about how period poverty is actually a big barrier to accessing education. And even in a country like Canada, there are 1 in 7 girls who are unable to go to school and who actually miss school because of this inaccessibility. And so when I learned that my friend was not alone, and it was in fact 1 in 7 girls just like me who miss school because of this biological barrier, it really frustrated me. And I figured out, how can I influence and change the system that we have to allow them to access their basic needs, and education being one of them. So I ran for school board trustee, and when I ran, I was elected at 16 years old, and it was quite intimidating because I stood on that board table saying, we need to invest in menstrual hygiene products in all of our school washrooms. And a lot of the male colleagues at the time didn't understand the importance of such a thing. And so for me to work with with all of the menstruators and female voices in our community was a way of me understanding how can we leverage policy to influence change in educational institutions. And I realized that maybe health and education are so interconnected. So I didn't start off to be an SDG advocate or leader, but it was really my experiences with my friend that kind of led me in this path.
Yeah, that's an amazing story. I think I'd be very I'm inspired like when I look to the future. I tell you, there's a couple of reasons why. I have two young girls, two daughters of mine, 9 and 7 now. And when I ask them, what do they want to be in the future, my 9-year-old says to me, "Well, I want to be an artist and I want to help homeless people." So I think this is like a transition. We're moving towards an economy and a value system which is focused on helping others, like a social contract that you said, redefining a social contract. From your perspective, like looking to the future of education, do you see huge opportunities, huge transformational change coming? Because, the jobs of the future are not necessarily the jobs of today, and the skill sets that we have. There's going to be a massive transition. If you just look at our energy, for example, we're going to need a whole new workforce. What's the sort of planning that you're looking at for the future, from because it's very important to understand what your perspective is and where do you see these future unicorns being developed?
Oh, absolutely. I see huge transformations taking place. And one thing that we actually did was launch a youth declaration during the UN General Assembly, and we presented this to the Secretary General. But this youth declaration, it brought together the voices of over 500,000 young people and from 170 countries. And the biggest message was we need investment in health education, climate education, and digital literacy. And then beyond that, it was we need to transform pedagogical systems and invest in the education, the educators, and their professional development as well. And then the other part was investing in inclusive, sustainable, and EDI focused education systems. So there's 5 different pillars here, right? Whereas first one is around inclusivity, the second one is around teachers, the third one is around digital transformation, the fourth one around sustainability, and the fifth one that kind of unites everything together is financing for education. And we've already seen that there are so many more commitments that were launched by different nationalities and countries leaders who said that we're now going to invest X amount in our global fund for education, and really start by understanding how can access to education be the first priority. How can we first meet the access, first be inclusive to everyone and who accesses education, and then take the step forward? But you also mentioned something that was super great, that there's a difference between access to education and curriculum versus access to quality education. And that's what we're here focused on. What does quality education look like in the future when we don't even know what the skills will be for the future? And in fact, there's a study that was launched saying that 70% of the skills that young people have right now won't even be applicable in the future. So we're not even meeting the needs of students right now for the future of the workplace, which means there's a huge gap. But the huge gap is the huge opportunity. And that's where I see a lot of private sectors working with educators to come together and understand how can we use the digital platforms that we have to transform not only the way that we teach, but the way that we think. And when we can transform the way that we think, we can transform the future.
Oh, this is music to my ears. And I think where you talk about new job creation and value creation, I think a lot of if we look at, we used to look at healthcare as a cost, whereas really it should be looked as an opportunity to create value, because by keeping people fit and well, it generates economic value, which is what we've not done in the past. I also think in terms of education, it shouldn't be seen as a cost. It's, as you say, it's an investment. It's a future investment for our society. One of the things I was going to ask you about before we go into the opportunities for healthcare and education was this incredible transformation summit that you held. And you mentioned it earlier. You had over 150 ministers of education discussing key elements for transform. That's quite an audience. What are the next steps that you have in terms of SDG 4? Like, I mean, you mentioned Paris next week. Can you tell those who are listening or are viewing this, how can the youth get engaged further in this process? I know we have a global social prescribing alliance, for example, and we have our WIS platform as well, and we have youth engagement through student panels and so on. We'd very much like to be part of this. How do people get involved?
Absolutely. There are so many opportunities for young people. And to any youth listening, feel free to drop me a message on social media or an email, anything, and we'll get you involved if you're passionate. But the one thing that we're working on is launching a global youth initiative. And this is focused on getting young people to become from going from advocates to actually effective leaders. And this is a conversation I've had a lot of times in this space. How do we go just from speaking about something to actually making a difference? And for me, my journey started the opposite way, where, I leveraged policy and then I got into advocacy. And so we're trying to now invest in the training of young people, upskilling them, reskilling them, and developing their capacity to influence change. And this is an initiative that we're working on with UNICEF right now. It's under its ways. And we're really focused on how do we kind of invest in young people to become effective leaders that actually transform education in their local regions. So that's what the Global Youth Initiative is also going to encompass, and it's also going to focus greatly on the Youth Declaration that we launched. This declaration had a series of recommendations for stakeholders, government partners, and private sector leaders on how they can transform education, but it also had a series of recommendations for young people to take ownership of this movement. And these commitments included working with these private sectors and advocating for what it is that we had set in that declaration. So we're focused on how can we localize the implementation of this and make it really meaningful. So hopefully the initiatives that we're launching can even connect young people with their local ministries and the governments, and as well as the private sectors and institutions, to really formulate that intergenerational partnership, because we've had a lot of intergenerational dialogue. So we're moving into a series of partnership.
Okay, this is a really important question. So building trust with youth. I mean, do you see that as an opportunity? I mean, what you're doing here is very important, and the future generations. How do you see we become more transparent, more open? This is the future of our society here. I think we have, this will really build us on a path of, knowledge and wisdom, and being able to make this transformational change. Where do you see the opportunities and the barriers for youth engagement with public sector, for example? Like, we need to have more people involved in politics. I mean, it's a very difficult job to be a politician. You're leading, you're showing that it can be done. You're a great example. How do we encourage more people to take up that opportunity?
It's tough. There's many layers. I think for some countries, they still need to focus on engaging young people, getting a seat at the table. But for other countries that already have a seat at the table, it's about not putting pressure on one youth to be the voice for the whole world of young people. And the other part is ensuring that youth voices are not tokenized. Oftentimes it looks really great on a proposal, oh, we spoke to this many youth, so it's all future proofed. But the reality is that sometimes it's not future proofed, because young people should not only be part of dialogues. As I said, it's not only about having them in advocacy positions, but seeing them as equal partners in transformation, meaning that they are also available and ready and have the skills, and trusting that they have the potential to facilitate partnership. And I think that's really important when we talk about trust. It's not only about trusting your experience and as where you come from as a youth, or as an Indigenous youth, or as a woman in STEM, or as a young person with disability. It's about trusting you as who you are, regardless of the experiences that you've had in life, although they do make a young person who they are. But sometimes we'll hear, oh, you're not a child in Africa, so you have no right to comment on education being accessible. Well, that's not true, because there's so many inaccessibilities in every single country. And so we really need to encourage youth engagement and youth partnership, and not discourage it by making it tokenized, or just saying that we have a youth council behind us, meaning that we haven't silenced their voices. when coming forth with a proposal. It's about taking into consideration that what young people are saying is true, right? A big part of trust is validity. And so it's about validating that young people know what they're talking about, they have the skills, and they have the potential to actually make a difference. Just because we have school doesn't mean we can't influence the world.
Yeah, I totally agree with you. And also it is hard work. Like, it's not easy to put yourself forward there. And that's where I think we need to support those people who actually do put their head above the parapet, because it is a difficult job. Like, it's not easy to stand up there and say this isn't working or this isn't right. It could be seen as problematic when actually you're being very solution focused, and you're actually offering an alternative. So now let's talk a little bit about the opportunities we discussed with health and education, because navigating health systems requires education, understanding how to be treated. For example, these are huge opportunities. But when we look at future workforces, so for example, the health system is going to be short of 18 million staff by 2030. Okay, this is and if we have the opportunity to move the dial from disease management to prevention, that's a massive opportunity to develop a new workforce and develop new educational models and new skill sets. Do you see that this paradigm shift to, I mean, I'm seeing it now more often. Even I seen it yesterday. It was quoted on a digital forum about values, creating value through digital means. And this is something we've been talking about since 2015. Do you think that the system is ready? Because in health systems, it can take up to 17 years for change to happen. So if you look at 2015, when we started what we were doing, we're halfway there. But do you think that that's a massive opportunity? SDG 3 and 4 could be the leverage, create lots of new jobs in preventative medicine, for example.
hmm Is the system ready? I don't think so. But with education and SDG 4 working with SDG 3, I definitely think it can be. There's a lot that needs to be done, as you're right, to move to prevention. And we've seen that in, areas of mental health and well-being, where we're now focused on better understanding ourselves. And even in our curriculum here in Canada, now we're focused on how can we not only prevent our physical health injuries, but also manage our mental well-being. And how does that kind of fit in to our picture of our entire well-being? And companies now are also investing in mental health resources. Educational institutions now have supports for mental well-being as well. And there are so many more accommodations and understandings that we are now focused on to prevent and protect mental well-being. So I definitely think in that area we've made a lot of strides. But there are a lot of conditions, and yesterday was World AIDS Day, where we see that there's still not a lot of education about oneself or about one's health. And when education is not accessible in rural areas, how can you expect these people to understand what is happening to themselves, what is happening to their own bodies, and how can they take ownership of their own health? So I think that's a big concern. And how do we mitigate that? How do we reach them? It's about, one, ensuring that education is accessible, right? If people can understand about their conditions, then that's solving half the problem, because then hopefully they will start to take better care of themselves, because now they have that newfound knowledge of what does care truly look like. And it's really hard in an education in a field where there are so many variabilities. I met these different children. I was at the Sick Kids Hospital last weekend, and I met children with a lot of different rare genetic conditions. And the only thing that I remember the mom saying was, I just want to know what's happening with my child. If I just have the knowledge, then maybe I can do something about it. And that really goes to show that education is central in the way that we approach healthcare and in the way that we approach our healthy societies, right? We talk about healthy communities and healthy societies. That starts with education. But education also has the power to dismantle gender inequities and bridge the gaps that we so have. We talk about comprehensive sexuality education and how that's a key in living a healthy life. And that also can help dismantle stigmas associated with sexual reproduction health and, period poverty, for example. So I really do believe that there's a lot of opportunities, but the matter is only in, one, as you said, trusting young people to be a part of the solution, not silencing them when they have ideas, and working together as a society to make this happen.
Yeah, these are such great points. I mean, the first thing that you said there was so honest. I think, yes, if I'm being honest, there are opportunities, but we're not ready yet. I think we're trying very hard to make that transition. But if you look, 90% of the budget still goes into disease management. So that's its own story. It tells what it. And then if you look at what happened, I think you touched on it in terms of knowledge management, in terms of education. If you look at when the pandemic hit, for example, and today I was just looking at the excess deaths and the mortality rates over the last 12 months. It's startling. It's actually quite shocking. And the really high prevalence of excess deaths at the moment. And that's probably down to a number of causes. Of course, COVID infections, but then also, the delayed in treatments. We've had 28 million delayed surgeries, for example. This will all have impact on mortality rates. We're seeing cancer diagnosis at stage 4s now and stage 3s, so this is having a knock-on effect, the pandemic. But I think what you mentioned about the children and the families and the wider impact when there's a rare disorder, for example, or a condition, it's so important for us to reach out to parents and to families to try and allow them to understand the treatment, the pathway, and what's going on. Because what you said there resonates with me, because in many ways we've had similar family experiences, but we were able to deal with it. My daughter was quite ill when she was younger, but we were able to deal with it because we understood, and we were able to accept and understand what the process was. We were able to, like, the information that was given to us by the consultant, we were able to digest it and then go off and do our research ourselves, because I had the background in it. So I was able to study and go, okay, I understand what the outcomes will be, and I put my mind at ease. But not many people have that at their disposal, and that takes 20 years of experience to understand that sort of clinical terminology. So these are really valid points, and I think you're right. Challenges, but then opportunities. Investment has to flow, and I think education and health together could be a very powerful lever. Tell us, in your mind, going forward over the next, look, we've 8 years until 2030 agenda hits in. We're not really on target in terms, if we're being honest, in terms of where we are with the SDGs. We see the same situation with climate. How do you think we're going to be able to make this transition over the next 12 to 24 months? Because in my mind, COP28 next year is probably going to be one of the most important events for our global society to be able to make things happen. Because COP27 this year, I'm not really sure whether it hit the nail on the head. Where do you think we can make these huge changes? What needs to happen?
That's a great question. And I think we need collaboration. There's oftentimes we work in different SDGs, and I think it's so great that what you and I are doing, combining SDG 4 and SDG 3, and that's what we really need, because we have to see that all these SDGs work in intersection. And if we work on them separately, we can't move the dial forward. We need to bring in all different experts, climate experts, educational leaders, pedagogical leaders, healthcare workers, people who have their PhD in health policy. We need everyone to become together to work towards understanding how can we chart a new way forward for our world. Because when we talk about healthy communities and healthy cities, there's a huge intersection that you're right, that climate plays, right? We see a lot of companies now investing so much in their fossil fuels, but there's also some companies who are divesting from fossil fuels. And this makes us question, what does really that fossil fuels have an impact on our own health? What about greenhouse gases? And how can education about these greenhouse gases or climate change influence the way that business leaders lead their communities and their businesses? And then how does that then affect the health of our society? It's all interconnected. And once we start seeing it that way, and once we start educating politicians, then maybe change can be made in the government sector, because governments make change that are sustainable and long lasting. And oftentimes I've noticed that government leaders, even those in ministries of health or education or science, are not knowledgeable about the effects that need to be made, or like the changes that need to be made in these areas. And it's heartbreaking sometimes, especially to see that these people themselves are not educated, but they're the first advocates. So I think in society, we need to move from advocacy to hosting, COP every single year, and actually focus on partnership. I would love to see a COP that's focused just towards action, and maybe even taken off like the live stream, or taken off the PR buzz, the media buzz, the social media. It's just taken off to it's to move forward from a PR game to a partnership game. And I think when we move from that, we can measure success differently. But oftentimes, conferences and summits measure their success based on the number of participants included, based on the number of social media outreach, when in fact, it should be on the number of partnerships made.
No, I totally agree. I think SDG 17 is one of the most important goals, partnership for the goals. If we are going to, shall we say, turn it around and have a sustainable future, that is the future. My question is, because I think there's key partners that we really need to bring into this conversation. It's something next week I hope to go and have a meeting in London with a number of banks, for example, around investments. And that's kind of what I'm focused on at the moment. It's very much around raising capital for SDG funds. How, bridging into the banking sector, because my invitation is to those who are watching this or listening, please reach out. We're in, and philanthropic donors and that, we're working on a number of funds to stimulate investments into the SDGs. And I think the knowledge that myself and yourself, Kenisha, have, being able to work with the banking sector as investors, because that's a key bridge that needs to happen. In the past, that's not what's happened. And we need to make a huge jump where the financial sector come in and work as partnerships. This is one of the most important levers, because we're told the finance is there, the money is there. But for some reason, and I can share my own experience as a social entrepreneur, I'm doing it 8 years, it's extremely difficult to raise capital in terms of this space where you can get the money to scale your ideas, even though it's proven. We have a proven methodology, a pound invested, 36 back in return investment in terms of societal impact. So we need to make sure that future generations like yourself, Kenisha, when you have an idea and it's a good idea, that you can get the investment. Do you think that's an opportunity? And in terms of bridging, how do we get into the banking sector?
Yeah, absolutely. And thank you for all the work that you're doing to invest in ideas of young people and bridge the sectors together. You're definitely right. We need to include banks. They're part and hearts of the economy. And so to work with these sectors is absolutely crucial, not only because we need to invest more, but because investing more actually brings a big ROI, as you said. And in fact, we were at the World Childhood Care Education Summit, where we talked about how investing one USD in a child in healthcare at early education actually can lead up to a return of investment of up to $17. So I don't think we've ever seen such a stock investment. You give $1, you make 17. That's 17 times what we get returned. And so that really shows that investing in early education and the early childhood care of young people and children is crucial to even seeing a better society at large. And in 50 years from now, 100 years from now, my generation is not going to be here. But what is going to be here is the systems that we have in place. What is going to be here is the partnerships, the investments, the banks that are going to be here. These are everlasting. And so if we don't invest in them now, we're going to have a generation that complains about our inaction and our lack of ability to invest in their futures. And that's not okay for the future of our world. And oftentimes I hear conversations around, if we just damage this earth, we'll just move to Mars. When in fact, that's not a great way to approach the planet and the society we live in. We can't move on to create different societies by damaging the one that we have now. So we really need to invest in climate change, climate education, healthcare, health education, and education being the central of it all, because education is the foundation of change. And we can't see transformations in any other SDGs without first transforming education.
Yeah, I totally agree. And I think you're being conservative there, the pound 17, because if you look, who knows who the next Steve Jobs, who knows who the next Bill Gates are? We don't know who they are. They're out there. And that investment, that dollar or whatever it may be, could turn out to be a generational change, where the future unicorns, they're out there. We need to find them. We need to also give people the opportunity. I think this is where a lot of our, we have very good solutions. There is no shortage of solutions. From my work, I can see the solutions. The problem we have is matching the solutions into the pipeline and making those solutions bankable for investors. That's the real issue. I mean, if we cut it back, and we need more dialogue, we need more open forums, we need more transparency. So look, what I'd like to do is, like, we're coming to the end of our discussion. I'd very much this has been an amazing discussion, but I'd like to put the last question to you. Like, where do you, your final thoughts? SDG 4, SDG 3, are you optimistic? Will we hit the targets by 2030? What do we do after 2030? This is some of the conversations I've been having now. We need to look at 2050, 2070. Over to you. Last final words, Kenisha, and then we can say goodbye to our audience.
I'm definitely optimistic. We've seen in the past with the Human Genome Project, it brought together the greatest minds that we've seen in history. It brought together banks, it brought together government leaders, it brought together, like partners, civil society partners, and the transformation that we've seen in healthcare over the past 20 years, we haven't ever seen before. So I am definitely hopeful. It's exponential growth all the way up from here. The only thing that we need to do is come together, not hate each other, not find competition. We need to find cooperation. And once we move from competition to cooperation, we'll see a brighter world. And after 2030, we need to continue working on this. And in fact, maybe we should even push 2030 agenda to 2050 because we're no way in track of reaching them. But I'm hopeful that everyone listening today, and in partnership with Gareth, you, and the work that I'm doing, we can all transform society together.
Yes, so I think this is very wise final words from Kenisha there. I am absolutely delighted that we've got the chance to speak today. From my perspective, it's been a pure honor, Kenisha, to have this discussion. The wise words at the end, it's all about partnership for the goals. Trust is the oil of the future in my mind. We very much need to move the dial towards action. Not talk, build bridges between different counterparts across different multi agencies, shall we say, from health, education, industry. We all need to come together to work together. So that's very much what we're focused on. And then delivery of the SDGs. I hope you've enjoyed this session. Our next session is on digital, which is at the end of the year. Last session, 30th of December. I hope you can join us. From me, all the recordings are up there live on our YouTube, www.wis.world, and we'll sign off, but we'll very much look forward to welcoming you in the near future. If I don't see you before Christmas, have a great Christmas, everyone. And Kenisha and myself would say goodbye. So thanks everyone for listening, and we'll talk very soon.